Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
In amyloidosis, the term amyloid means starch-like, and it originates from an observation by the German scientist Rudolf Virchow, who noticed unusual deposits in tissue that turned blue when stained with iodine, similar to plant starch. In reality, amyloids are proteins that adopt an abnormal structure, causing them to clump together and accumulate within tissues. Amyloidosis is the disease that develops due to tissue damage resulting from the deposition of these misfolded proteins. Under normal conditions, our cells constantly produce thousands of proteins, and each of these proteins must fold into a specific shape to function correctly. When a protein folds improperly, it is usually detected quickly and broken down by proteases, which are enzymes that cut large proteins into smaller fragments. In amyloidosis, protein folding can malfunction in several different ways. One possibility is that normal proteins are made in extremely large quantities, and even a small proportion of them fold incorrectly. Another possibility is that abnormal proteins with faulty amino acid sequences are produced in normal amounts, but they misfold. In either situation, these misfolded proteins, known as amyloids, begin to accumulate. Sometimes there are simply too many amyloids for the proteases to degrade, and at other times, their folded structure makes them difficult to break down, similar to a pistachio, with no opening for your fingers to grip. Nightmare. When amyloid proteins are released from the cell, they often aggregate and form a rigid, insoluble structure called a beta sheet, resembling a folded piece of paper. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. These beta sheets then accumulate in the extracellular spaces of tissues and lead to tissue damage. Thus, amyloidosis is a condition characterized by excessive protein deposition, and there are many different proteins and diseases that share this same underlying mechanism. In general, amyloidosis may be systemic, meaning the protein deposits involve multiple organ systems, or localized, meaning the deposits are confined to a single organ. Until recently, systemic amyloidosis was further classified into primary amyloidosis, in which amyloidosis was believed to be the main disorder, and secondary amyloidosis, in which another known disease process led to the protein deposits. However, this classification is not entirely accurate, because an underlying disease process has now been identified, even in the so-called primary form. So, AL amyloidosis, which was previously called primary amyloidosis, is named such that A stands for amyloidosis, and L represents the immunoglobulin light chain that becomes misfolded and deposited. In plasma cell disorders, such as multiple myeloma, plasma cells in the bone marrow produce an excess of light chains compared to heavy chains, and these extra light chains spill into the bloodstream. Because of the large number of light chains, some of them misfold into AL proteins and accumulate in different tissues. In AA amyloidosis, which was previously called secondary amyloidosis, the misfolded protein originates from serum amyloid A. Under normal circumstances, serum amyloid A is a correctly folded protein and acts as an acute phase reactant, meaning it is released into the bloodstream by the liver during inflammation. However, when inflammation persists for a prolonged period, such as in rheumatoid arthritis, inflammatory bowel disease, various cancers, or hereditary immune disorders like familial Mediterranean fever, large amounts of serum amyloid A circulate in the blood. A small fraction of this serum amyloid A then spontaneously misfolds into amyloid proteins, which accumulate in tissues and result in amyloidosis. In systemic amyloidosis, amyloid proteins deposit in multiple organs throughout the body. In the kidneys, amyloid deposits can injure the podocytes, which are the cells lining the glomerulus. When podocytes are damaged, proteins such as albumin leak into the urine, leading to proteinuria, protein in the urine, typically exceeding 3.5 grams per day, and hypoalbuminemia, which is low levels of albumin in the blood. Over time, reduced protein levels in the blood lower the oncotic pressure, causing fluid to move out of blood vessels and into surrounding tissues, a condition known as edema. Albumin and other proteins normally suppress lipid or fat synthesis, so their loss results in hyperlipidemia, meaning elevated lipid levels in the blood. These features together represent the classic hallmarks of nephrotic syndrome: proteinuria, hypoalbuminemia, edema, and hyperlipidemia. In the heart, amyloid deposits can cause the cardiac walls to become stiff and non-compliant, leading to restrictive cardiomyopathy, a condition in which the ventricles cannot properly relax and fill with blood. Over time, this impaired filling can progress to congestive heart failure. Amyloid deposits may also disrupt the heart's electrical conduction system, resulting in arrhythmias or irregular heartbeats. In the intestines, amyloid deposits can injure the tips of the intestinal villi, which are small finger-like projections that increase the surface area for nutrient absorption. When these villi are damaged, nutrients are not properly absorbed and instead pass into the stool. Amyloid deposits can also accumulate in the liver, spleen, or tongue, causing these organs to become enlarged. Finally, amyloid deposits can damage peripheral nerve fibers, including those that transmit sensory or motor signals, as well as autonomic nerves that regulate functions such as digestion and blood pressure. In localized amyloidosis, amyloid accumulates within a single organ. A well-known example of this is Alzheimer's disease. Alzheimer's is a neurodegenerative disorder that occurs when proteins known as A-beta peptides accumulate in one organ, the brain. These A-beta peptides aggregate and form plaques that lie outside neurons and disrupt neuron-to-neuron communication. Amyloid plaques can also deposit in the walls of cerebral blood vessels, a condition called amyloid angiopathy, which weakens the vessel walls and raises the risk of hemorrhage or rupture. These plaques can provoke an inflammatory response, leading to neuronal damage and, over time, resulting in impairments in brain functions such as memory. Another example of localized amyloidosis is familial amyloid cardiomyopathy, also called ATTR amyloidosis. This is a genetic condition in which a mutant transthyretin protein, or TTR, misfolds and deposits within heart tissue, leading to restrictive cardiomyopathy. In contrast, Senile cardiac amyloidosis occurs when normal TTR protein slowly accumulates in the heart over time. This process usually becomes clinically significant only after many years, so it primarily affects older adults. Amyloids can also accumulate in the pancreas. For example, in type 2 diabetes mellitus, the beta cells of the pancreas, located in the islets of Langerhans, produce more insulin than normal. Along with the increased insulin secretion, beta cells also release higher amounts of a protein called islet amyloid peptide, or amylin. Over time, amylin aggregates between beta cells within the pancreatic islets, triggering inflammation that results in beta cell damage and eventual cell death. The symptoms of amyloidosis can vary greatly. When the kidneys are affected, swelling may occur in the face, ankles, and legs. Involvement of the heart can cause palpitations and shortness of breath, and intestinal involvement can result in malabsorption and weight loss. Some individuals develop an enlarged tongue, which may interfere with speech and swallowing and lead to noisy breathing during sleep. Nerve involvement can cause numbness or pain in the fingers and toes, as well as alternating episodes of diarrhea and constipation, or orthostatic hypotension, meaning a drop in blood pressure that makes a person feel lightheaded when standing up. The central nervous system is usually spared, except in Alzheimer's disease, where the primary features are memory loss and difficulty learning new skills. Download our microbiology study app made for researchers like you. The diagnosis of amyloidosis usually requires a biopsy of the affected organ or a fat pad biopsy, in which fat tissue is removed from the abdomen. The collected sample is then stained with a special dye called Congo red, which causes amyloid to display a characteristic pink coloration. When examined under polarized light, the amyloid proteins exhibit a distinctive apple green appearance. Unfortunately, there is no effective way to remove existing amyloid deposits. So when an organ has sustained severe damage, organ transplantation may be considered as a treatment option. All right, let's do a quick recap. Amyloidosis results from the deposition of misfolded amyloid fibrils and can be systemic, affecting multiple organ systems such as the kidneys, heart, and intestines, or localized, as seen in the brain in Alzheimer's disease, or in the pancreas in type 2 diabetes mellitus. On tissue biopsy, amyloid proteins stain pink with Congo red dye and display an apple green appearance when viewed under polarized light.